Bio 139 lectures, blood. In this video, we are going to learn about lymphatic system. So what is lymph? Our blood, it carries oxygen and nutrients to all parts of the body, and it circulates in the vessels. Those arteries, as they move along, they become smaller and smaller arteries till they become arterioles, and then they become capillaries. There is an arterial capillary bed, and then there is a venous capillary bed. So in this blood on the vessels, two forces are acting upon the blood. One is the hydrostatic pressure, which is trying to push the blood out of the vessel. And then there is osmotic pressure, which is trying to keep the blood in the vessels. So what happens in this capillary blood, that over here, the blood, it moves out of the vessels and then it is again reabsorbed at the venous end. So at the arterial end, it leaves the vessels, and at the venous end it is reabsorbed, and it is here where the exchange of the gases and the nutrients it happens. So every day about 20 liters of blood, it is pushed into out of the vessels here, and then the 17 liters of blood, um, it is again taken in the venous side. So we have a loss of 3 liters of blood. This 3 liter of blood, it stays here. Similarly, in the other capillary beds, there is this fluid which is left. This fluid is clear in color and it contains some proteins, but it does not contain any red blood cells. This clear fluid is known as lymph. Then there are channels which are known as lymphatics and lymphatic vessels. These, they take this lymph from here back to the circulation in the heart. So they take it from here and put it back in the venous circulation near the heart. These channels are known as lymphatic vessels. So our lymphatic system, it returns leaked fluid into the blood. Now we have lymphatic system, and then we have lymphoid cells, tissues and organs. Lymphatic system, it consists of lymphatic vessels and lymph nodes. So these lymphatic vessels, they return the blood to the circulation, to the blood vessels, to the venous side of the blood vessel. And then these lymph nodes, they are present along the pathway of the lymphatic vessels. Lymphatic vessels, many times they pass through these lymph nodes. So if this is like a lymphatic vessel moving along, then there will be small lymph nodes in this pathway, and these lymph nodes, in a way, they filter the lymph. So if there is any pathogen or any cell debris or dead cell, they try to remove it. Also the cancer cells, they try to remove it from the lymph. So these are the lymph nodes, and then these lymph nodes, their other job is that they present that pathogen to the immune cells. What are the immune cells? The T lymphocytes and the B lymphocytes. So they can mount an immune response. So this is our lymphatic system. Lymphatic system consists of lymphatic vessels, lymph nodes, and this. Then we have another system which contains lymphoid cells, tissues and organs. So there are lymphoid cells which are present in various tissues, which are diffusely present in various tissues, and then in some of the tissues they form aggregates which are known as lymphoid follicles, and then there are some organs which we call lymphoid organs. These lymphoid organs are thymus, MALT, mucosa associated lymphoid tissue. It is present in the GIT under the mucosa, and also in other systems. Then we have spleen, and then we have lymph nodes. So lymph node is a part of the lymphatic system and the lymphoid organs. It is present in both. So the important thing to notice here is all of these, out of all of these structures, all of these lymphoid organs, lymph nodes are the only ones which clean the lymph, right? They are the only ones which clean the lymph. And when they find pathogens in the lymph, they try to contain it. As a result, these lymph nodes, they become enlarged, and the physician can palpate these lymph nodes. And when we see when we can palpate lymph nodes in a patient's body, then we can know that some inflammation or infection is going on in this person. And lymph nodes, they have an afferent starting with A vessels which bring in the lymph, and then they have efferent vessels. So afferent vessels, they are coming into the lymph nodes, and then there are efferent vessels which are going out of the lymph node. Whereas and they have two functions. Number one is that they clean the lymph, and number two is they mount an immune response. So this is about the lymph nodes. Whereas these other structures, these other four structures, they only have efferent vessels for the lymph, only efferent lymph channels. So it means that lymph is not coming into them. The lymph which seeps in here, blood is coming here. Sorry about that. So they only have efferent vessels. All right. So this is the difference between spleen, mold, thymus, and lymph nodes. Now this is just what I just said. I have written over there. Lymphatic system consists of three parts: lymphatic vessels, lymph, and the lymph nodes, and then we have lymphoid organs, and they mount immune response in the body. They are responsible for the mounting immune response, and they're part of the immune system of the body, you can say. So these structures are spleen, thymus, tonsils, other lymphoid tissue, and the lymph nodes. Now, in this diagram, you can see this is the capillary, this is the arterial end of the capillary bed, and this is the venous end. So over here, when the blood moves through the capillaries, it moves out because of the hydrostatic pressure, and then at the venous end, it moves back in because of the osmotic pressure. And 3 liters of the fluid is lost in here. It cannot go back into the venous circulation, so that is taken by the lymphatic vessel. And now there are some points about the lymphatic vessels. It is a one-way system. Okay, it is a one-way system in which the lymph flows towards the heart. So they go towards the heart. They don't come back towards the body. That is like from the blood it has leaked out. And then they are present in between the tissue cells and the blood capillaries. See, they are present here, the lymphatic vessels. And there are some tissues which are in which there are no lymphatic vessels, like bone, teeth. In the CNS, they are present only in the meninges. Okay, so they have a one-way direction of lymph because of certain features. They have flap-like mini valves, and then they have anchoring collagen filaments. They are made up of overlapping endothelial cells. And these endothelial cells, where they overlap, there are flap-like mini valves. These valves allow only one direction flow of the fluid. So the fluid can go inside the lymphatic capillary. It cannot come back out from the lymphatic capillary, because if it comes back, this cell, it presses against this, and this flap is closed. And these flaps, they are anchored to the connective tissue, to the surrounding connective tissue, via these anchoring collagen filaments, and they also make sure that it is one-sided flow of lymph. Now this is just like our arteries. They turn into smaller arteries, and then into arterioles, then into capillaries. Similarly, these lymphatic capillaries, they are, first of all, the first step is the capillaries, then they change into lymphatic vessels, which are bigger than capillaries, and then they make lymphatic trunks, which are further bigger vessels compared to the vessels. They're bigger, and then they turn into ducts. We have two ducts. We have thoracic duct and right lymphatic duct. And the lymphatics in the skin, the superficial lymphatics, they travel along the superficial veins, and the deep lymphatics, they travel along the deep arteries. Now these are we are talking about the trunks. So on the right side we have different lymphatic vessels, and on the left side we have different lymphatic vessels. So let's talk about the trunks. The major trunks, they are named according to the region that they are draining. So we have a paired lumbar. So there is a right lumbar, a left lumbar. Then we have intestinal. Okay, this is known as cisterna chyli or cisterna chyli. I don't know how to pronounce it. So this is where the thoracic duct. Thoracic duct is the main duct of the left side. It begins, and when as it goes up on the upper part of the body, this left bronchomediastinal trunk, left subclavian trunk, and the left jugular trunk, they join. They also drain into the thoracic duct, and then this thoracic duct, it drains into the venous system at the junction of the internal jugular vein and the subclavian vein. So this is thoracic duct. It covers most of the it covers all of the lower body and the abdomen and the right side of the upper body. All of this is drained by the thoracic duct. Then on the left side we have right lymphatic duct. This is right lymphatic duct. So the right lymphatic duct, it has right bronchomediastinal trunk draining into it, then right subclavian trunk draining into it, and right jugular trunk draining into it. Just like it was on the left side, it was draining into this thoracic duct. So these three tributaries, they drain in the right lymphatic duct and right lymphatic duct. It then drains at the it enters the venous circulation at the junction of the internal jugular vein and the subclavian vein. So here, so this covers very short, only the right side of the body, the the head, neck, arm, and the upper thorax. It is drained by the right lymphatic duct. Now let's see in another diagram. It will be more clear here because that diagram was kind of complicated. So these are the major trunks. Our major trunks are this lumbar. We have right lumbar and we have left lumbar. So both of these right and left lumbar trunks, they are draining into the thoracic duct. So both from the right leg and from the left leg and from the right side of the abdomen and the left side of the abdomen, the lymph is draining into the thoracic duct. And then this is the single intestinal trunk. So this is all going in the thoracic duct. And then from the upper part of the body, this is like jugular trunk is coming here, then subclavian and bronchomediastinal, and then this thoracic duct, it is draining, it is entering the venous circulation at the combination of jugular vein and superior vena cava. And on the right side also we have this right lymphatic duct. Right lymphatic duct is only draining the head and the neck and the arm and the upper thorax. So its tributaries are jugular trunk, subclavian trunk, and the bronchomediastinal trunk, and it also enters the venous circulation at the junction of the internal jugular vein and the subclavian vein. And now this diagram I got from your Pearson text. So the green portion is the right lymphatic duct. Okay, this is drained by the right lymphatic duct. And remember, the lymphatics only move one way towards the heart. And this, all of this pinkish area, it is drained by the thoracic duct. So this is the beginning of the thoracic duct. Is at this point, this dilatation, it is known as cisterna chyli. This is where the thoracic duct, it begins. And now how does the lymph move up towards the heart? Because we know that it is moving against the gravity. What makes the flow of the lymph possible? So there are certain mechanisms. Lymphatic vessels themselves, they are low pressure channels, and the mechanisms that promote lymphatic return, they are first of all the milking action of the skeletal muscles. So when the skeletal muscles, we make them contract and then relax, so that action, it moves the lymph. So if sometimes you're sitting for a long time, so it's a good idea to just contract your leg muscles so the lymph flow can happen. And then there are pressure changes in the thorax during breathing. During breathing, we know in the thorax there is negative pressure that also pulls the lymph up. And then there are valves, just like we went over. There are valves in the lymphatic channels which prevent the lymph from flowing back. And then the pulsations of the arteries in the nearby lymphatic bundle. So what is this? So in many parts of the body there is an artery. So let me just make it here, like an artery, a vein, and this is a vein, and a lymphatic channel, and they are all kind of I hope it does not cover it all. They are kind of enclosed in a connective tissue sheath. So this lymphatic vessel, because of the pulsation of this artery, the lymph is going to move up. And then there are smooth muscles in the walls of the larger lymphatic channels. And then also physical activity or passive movements, they all increase the lymph flow. What are the functions of the lymphatic vessels? Lymphatic vessels have four functions. Number one, they return the excess fluid, tissue fluid to the blood. So like the 3 liter out of 20 liter, which was unable to go on its own in the venous, it is returned by the lymphatic vessels. And then sometimes, you know, there are small proteins, they also leak because of the pressure into the extracellular space, into the interstitial space. So those proteins, they're unable to go back into the venous circulation. So the lymphatic channels, because they're more permeable, those proteins can enter the circulation through the lymphatic channels. And then these lymphatic vessels, they carry the pathogens to the lymph nodes, and then lymph nodes, they present it to the T cells and the B cells, so immune response can be started and that pathogen can be removed from the body. And then the last but not the least function is that they carry absorbed fat from the intestine to the blood through lacteals. So what happens, our fat is absorbed in a form that it is a big molecule. That molecule cannot directly enter the capillary. So there are special lymphatic channels in the intestines which are known as lacteals. Lact is from white because this is whitish in color, milkish. And this, they enter there, these the fat molecules, they enter in lacteals, and then these lacteals, they take them back to the blood. Now, what can go wrong with the lymphatics? What clinical conditions we can have? So there is one condition which is known as lymphangitis. What is lymphangitis? Lymphatic vessels, for their own nutrition, they are surrounded by small blood vessels which are known as vasa vasorum. When there is inflammation of the lymphatic vessel, these vasa vasorum, they become congested with blood, and they are kind of visible. So this is their vasa vasorum, because of the congestion of the vasa vasorum. This reddish streaks we can see. This condition is known as lymphangitis. Then sometimes there is lymphedema. Lymphedema is what that swelling can happen. So when the lymph flow is blocked, the lymph cannot enter back into the circulation, then there is an edema, and that can happen when the lymphatic vessel has been blocked, for example by a tumor, or maybe it has been surgically removed. So that body part, it can swell and it is very painful. It is known as lymphedema. Okay, now let's come to the lymphoid cells and tissues which found in the lymphoid organs. So we are coming to the second our system, our kind of overlapping system. So we have a system of lymphoid cells and tissues, and then we have lymphoid organs. So these lymphoid cells and tissues, they are dispersed in different tissues of the bodies, these lymphoid cells, and also in some tissues they are dispersed. But some also we have some lymphoid organs. And what are the common features? So they contain a reticular network. So these are reticular fibers, and if there are reticular fibers, there also will be reticular cells. These reticular cells, they have made that meshwork of these reticular fibers. And then we have macrophages. One of our lymphoid cell is macrophage. And then we have lymphocytes, T lymphocytes and B lymphocytes. And then there is another cell which is known as dendritic cell. It is not present here. So let's move ahead and we can read about that. So these are our lymphoid cells. Like I just spoke about, that we have a lymphatic system, but now we are talking about the lymphoid cells. All right, so don't confuse the two. So these lymphoid cells, they are lymphocytes, macrophages, dendritic cells, and reticular cells. What are lymphocytes? They are made by the red bone marrow, and they mature In the bone marrow, the B cells they develop in the bone marrow, whereas T cells they go to the thymus. So these are our lymphocytes. Then macrophages are present, and macrophages they play important role in activating T lymphocytes. They present antigens to the lymphocytes and they activate them. Then we have dendritic cells. Dendritic cells they are found in the lymphoid tissue and they also play a role in activation of lymphocyte. And then we have reticular cells which produce soma, which is a network that supports other cell types in the lymphoid tissue. So these cells are known as lymphoid cells, and they are not making lymph. They are going to mount an immune system. Okay, they are different from lymph. They are going to make an immune response. All right, now the lymphoid tissue, it may be diffused lymphoid tissue. It can be like diffuse lymphoid tissue means that lymphoid cells tissue, it is like loose arrangement of lymphoid cell and some reticular fibers in different parts of the body. And then in some parts of the body, this lymphoid tissue, it makes lymphoid follicles or lymphoid nodules. They are solid spherical and they consist of tightly packed lymphoid cells and reticular fibers. So the components are the same, but they are tightly packed, and they may become part of larger lymphoid organs, or they may be found as aggregations. For example, one of the example is Peyer's patches in the intestinal wall. They are lymphoid follicles or lymphoid nodules with just like concentrated lymphoid tissue. And now this brings us to the lymphoid organ. So we discussed the lymphoid cells, and then we discussed that lymphoid tissues can be dispersed, or they can make nodules in different tissues. And then we have some organs which we call lymphoid organs. We have primary lymphoid organs, which are the thymus and the red bone marrow. These are our primary lymphoid organs, because red bone marrow, it makes the lymphocytes, and then those lymphocytes, the B lymphocytes, they develop in the bone marrow, whereas T lymphocytes they develop in the thymus. So these two are our primary lymphoid organs. Then we have secondary lymphoid organs. The job of the secondary lymphoid organ is to present antigen to the lymphocytes, so lymphocytes can start working. So secondary lymphoid organs are lymph nodes. The lymph nodes are one of our secondary lymphoid organs. Then we have tonsils. We have a circle of tonsils in the pharynx. Then there is spleen. Then the Peyer's patches in the small intestine, the lymphoid nodules. Then appendix. So these are all our lymphoid organs, and just like I talked, mold, mucosa associated lymphoid tissue. These are all secondary lymphoid organs, and they help the lymphocytes to mount an immune response by exposing them to the antigens. Okay, so the primary, we are only going to read about the lymph nodes in a little bit of detail and not about rest of the lymphoid organs, because lymph nodes are also part of our lymphatic system. So lymph nodes, they are secondary lymphoid organs. They cluster along the lymphatics. They are small, about 1 to 1.5 centimeter small, but when sometimes they can also become enlarged when there is inflammation and they are trying to remove the pathogens or the cancer cells from the lymph, so they don't get into the circulation. So they are pretty important. We have hundreds of small lymph nodes which are embedded in connective tissue, but they are not visible. Under normal conditions, they are not visible because they are very small. Then we have some clusters of lymph nodes. These clusters of lymph nodes are present at specific places in the body, and this is where the physician can palpate them. So these regions are inguinal region, axillary region in the armpit, and cervical region. So these are groups of lymph nodes which can be palpated by the physician. So maybe sometimes you went to the doctor and they just doctor ran his or her hands under your chin, and then on the side of your neck, and on the top of your clavicle. So what are they trying to do? They are trying to palpate the lymph nodes to see if there is any inflammation or infection going on in your body. So this is just what I have already said. This is written over here. So I will just skip this slide and move to the next, and I'll talk about the structure of the lymph nodes when we look at the diagram. All right. So what are the two basic functions of the lymph node? Cleansing the lymph. They are the filters, right? and their macrophages are present in the nodes because they are lymphoid cells. So lymph nodes are going to have the reticular cells and their fibers, the cells, the macrophages, and they're going to have T cells, B cells. Okay, and then so macrophages in the nodes, they remove and destroy the microorganisms and other debris that enter the lymph node from the loose connective tissue, and then they also play a role in immune system activation. Antigens are brought to the lymph nodes from point of entry, and then there are dendritic cells. They present those antigens to the T cells and the B cells which are present in the lymph nodes. So this brings us to the structure of the lymph node. So lymph node is surrounded by a fibrous capsule, and this fibrous capsule, it dips in, right? This is dipping in. This is known as trabeculae. Okay, and then the lymph node outer part is known as cortex. In the outer cortex, we have germinal centers. These germinal centers contain dividing B cells, and deeper in the cortex, we have T cells. Okay. And then in the medulla, inner to the inner cortex, inner part of the cortex, there is medulla. In the medulla, the cords of cells, T cells and B cells are present. And then we have sinuses. So these are the afferent vessels. Like I told you, lymph nodes have afferent lymphatics and they have efferent lymphatics, because the lymph enters from here, then it goes to the subcapsular sinus. From the subcapsular sinus, it goes to the medullary sinus, and from the medullary sinus, it goes out from the efferent vessels. Efferent vessels are present at the hilum, and there are more number of the afferent vessels compared to the efferent vessels. This makes the exit of lymph from the lymph node slower compared to the entry. So this gives time to the macrophages and the dendritic cells to detect the pathogens and present them to the T and B cells. This is just what I have told you about. This is in the written form. And the sinuses are large lymphatic capillaries spanned by crisscrossing reticular fibers on which macrophages are sitting. These phagocytize foreign material in the lymph. Some antigens leak into the tissues and mount immune response in the T cells, right? So this is just I have written if you want to read it. So this is the circulation in the lymph node. I already went over it. So subcapsular afferent vessel is coming in. It goes to subcapsular sinus. It goes to smaller sinuses, and then it goes to the medullary sinuses. And from there, the efferent lymphatic vessels, they are present at the hilum, and they leave the lymph node. There are more afferent vessels, like I said before, than the efferent vessels. And now clinically what can happen? Lymphadenopathy. Lymphadenopathy means the lymph nodes are enlarged and they can be felt. So if they are enlarged because of inflammation, they will be tender to touch. Okay, they will be smaller and swollen and tender to touch. They are also known as buboes. Okay, but if it is because of cancer, because lymph nodes, they also try to remove the cancer cells from the lymph, then they are enlarged, but they are not painful.